Hello, my name is Asfa, and today I'll be talking about intra-arterial catheterization. First off, the uses of intra-arterial catheterization. It is used for continuous arterial blood pressure monitoring, and it is used during intraoperative period for major surgeries when difficult intravascular access is predicted. It is also used for the identification of normal wave patterns. The following are the equipment which is required for the procedure. An Allen's test is performed before the beginning of the procedure. The Allen's test is a standard test which is used to assess the arterial blood supply of the hand. This test is performed whenever intravascular access to the radial artery is planned. The radial artery is located by palpation at the proximal skin crease of the wrist, and then it is compressed with 3 digits. The ulnar artery is similarly located and then compressed with 3 digits. With both arteries compressed, the patient is asked to clench and then unclench the hand. Once the hand is unclenched, a blanking of the skin can be seen, and once the fingers are removed, you can see the blood flow return. Compress the ulnar and radial artery. Have the patient clench their fist. Remove compression from the ulnar and radial artery and have the patient open their fist. The hand appears lighter in color, release, and then observe the blood flow return. It is vital to ensure that it is the correct patient, the correct procedure. This is done by collecting patient information and correlating them with the present information. Explain the procedure to the patient and make sure that the patient is fully aware about the procedure and has no additional questions. Gain patient consent. Here is a brief overview of the procedure. First off, the artery is palpated. Second, the needle is introduced into the artery until pulsatile blood flow is observed. The needle is then kept perfectly still while the flexible tipped guide wire is inserted into the artery. With the guide wire in the artery, the needle is withdrawn. The needle must never be rethreaded over the guide wire, as this has a high risk of severing or fraying the guide wire. The arterial catheter is carefully guided over the guide wire. It is important to maintain a grip on the guide wire at all times. After catheter insertion, the guide wire is removed and the pressure transducer set is connected to the arterial line. Sterilize the area intended for puncture. Palpate the artery intended for puncture. It is then anesthetized with lidocaine. For this, a 25 gauge needle and a syringe is used. The needle is then inserted at a 45-degree angle and the lidocaine is slowly injected into the area. And insert the needle at a 45-degree angle. After insertion of the needle, insert the guide wire. Okay, once the guide wire is in place, insert the catheter and also make sure that it is also in place. After catheter insertion, carefully remove the guide wire. To keep the catheter in place, use a suture. Use gauze to wipe off excess blood. Apply transparent occlusive dressing to the site. Contraindications for this procedure are absent pulse, burns over the proposed site of cannulation, more specifically full thickness burns, as can be seen in the picture, burns which go through the epidermis, dermis, and up till the subcutaneous tissue, and inadequate or interrupted circulation. Thank you for your time and attention.